Welcome you all for the Academic Masterclass on Stanika Chikitsa on antenatal and postnatal care in Ayurveda, organized by Ayurveda MAP, initiated by MedMap. So before going into the session, let me introduce you the upcoming and ongoing program happening in Medical MAP. So first is Professional Diploma in Advanced Panchakarma, PDAP, which is a 6 months course, which is being happening in Ayurveda MAP. Next is Diploma in Ayurveda Cardiology, a certified course in cardiac disorder management in Ayurveda. Next is Diploma in Ayurveda Cosmetology, which is again a 6 months course. Next is Postgraduate Diploma in Sports Medicine and Rehabilitation, which is again a 6 months course. Next is Stanika Chikitsa in Sri Roga, a 4-day intensive hands-on training at SDM College UDP, which is happening. So the upcoming session for Stanika Chikitsa in Sri Roga, 18th April, 7:30 p.m. by Dr. Ajayan sir. So those who are interested can connect our Ayurveda MAP team for further details. The topic is concept of drug used in Sri Rogam, disease specific classification, Artava Janana, Stanya Janana, Yoni Shodhana, etc. Next comes our course Diploma in Antenatal and Postnatal Care in Ayurveda, which is again a 6 months course. It's a hybrid model where online and offline sessions are being conducted. It's a university-backed diploma course. So what are the topics? Applied anatomy, physiology, and neuroendocrinology along with conception. Rajaswalacharya, Garbha Samskar, Bija Samskar. Yoga in Garbha Samskar. Role of Panchakarma in the preconception stage, Bija Shuddhi. Diet, lifestyle modification for Bija Shuddhi, preconception. Maternal physiology and changes during pregnancy. Antenatal care, principles and protocols. Garbhini Paricharya, Masana Masika Charya, maternal complications and fetal complications, diagnosis, management, and multidisciplinary approaches to pregnancy complications, major and minor. Partograph, delivery complications, Prasava Paricharya and Sukha Prasava. Next is postnatal topic, postnatal care in special cases, assessment of Sutika and newborn, neonatal care, Jata Matra, Navajata Shishu Paricharya, detailed discussions on Shishu Paricharya and management of diseases of newborn, breastfeeding and lactation support, Sutika Paricharya, postpartum neonatal care, emergency management, first aid for Shishu and Sutika. Traditional postpartum practices, contemporary postpartum practices, mental health and psychological counseling in postpartum, music therapy in Garbha Samskar and postpartum period, cosmetology applications in postpartum care, antenatal and postnatal case sheet discussion, lifestyle and holistic counseling for new mom, ergonomics and exercises in antenatal and postnatal period, product making. You will have a live demo online sessions also. Apart from that, in the 3 days mandatory intensive hands-on training, you will be learning clinical assessment of pregnant women, Yoni Dupana, Yoni Pichu, massage to Sutika and newborn, Vetu Kuli preparation, special diet for Sutika, yoga for Sutika, bandaging to Sutika, breastfeeding techniques, postpartum counseling, safe baby handling, first aid for Sutika and newborn, product making, dietary planning and lifestyle counseling, techniques in Abhyanga, Marma support, safe maternal massage, special massages. These all you will be learning in the 3-day mandatory intensive hands-on training. Next, coming to today's session by Dr. Sutika Paricharya, 18 years of work experience in Ayurveda gynecology, infertility, obesity, Garbha Samskar, former student of G.S. Gune Ayurveda Mahavidyalaya, Ahmedabad, completed masters in Ayurvedic dietetics from Tilak Maharashtra Vidyapeeth Pune, founder Sushruta Wellness Ayurveda and Panchakarma Center Pune, founder Sushruta Learning and Education for Ayurveda course and webinars, Mahila Vaidya Sangatan Pramukh in Ayurveda Vidyapeeth Pune, diploma in yoga, have conducted various webinars on infertility, gynecology, herbal cosmetics preparation for Ayurveda students and doctors. He is also a Reiki healer and hypnotherapy practitioner. Today's topic is diet and lifestyle modification for Bija Shuddhi. Over to you, ma'am.
Thank you very much for having me. I'll just switch on my video and share the slide. Good evening, everyone. Firstly, I would like to thank the organizers for having me here today. Okay, I'm sure I'm audible. So today's session is about mostly about the introduction. And since you're going to we are conducting this detailed session, the diploma course, and hence today's session is going to be mostly the introductory session as such. So, but I would be covering most of the things as today's topic is dietary and lifestyle modifications or corrections to be advised in Bija Shuddhi. So before we begin, we should understand that what is Bija Shuddhi. So basically, this is an antenatal and postnatal program that you will be conducting and you will be participating in future. So antenatal and postnatal, everything comes under Bija Shuddhi. So basically, according to Ayurveda, Bija Shuddhi itself is goes into antenatal treatment, or we call it as Garbha Sanskar or Suprajanan Sanskar or Supraja Nirmiti Sanskar. So basically, most of the females after conception they come to us for antenatal program. After conceiving only in the third month or the first trimester, second trimester, they mostly come to us to for various treatments or Garbha Sanskar specifically or antenatal program specifically. But according to Ayurveda, antenatal programs are supposed to be conducted or supposed to be practiced before conception, which comes into Bija Shuddhi. So those we will understand about Bija Shuddhi. So Bija Shuddhi and antenatal program, it all goes hand in hand. It's not different. But of course, we mostly, like I would say 98% of patients or Garbhinis coming to us will definitely come to us after conception only for these antenatal programs. But we being Ayurvedic doctors, Ayurvedic practitioners, we practice infertility also. So those who are not able to conceive, those who are struggling for conception, they will definitely come to us. And these patients can be converted into Bija Shuddhi Chikitsa. And indirectly, we are conducting Garbha Sanskar or antenatal program on these patients. So Ayurveda suggests that antenatal programs or Bija Shuddhi for that matter, it all begins before conception. Of course, though we don't have patients coming to us for antenatal program, Garbha Sanskar before conception, but this view or this is the vision we have to change while we are conducting this certain sessions or while we are promoting your business. For example, most of the Vaidyas who have participated here, I'm sure most of you are practicing Vaidyas and are practicing Garbha Sanskar or already into infertility practice. So while you're promoting your practice, I would recommend, one second. So while you're promoting your practice in infertility or any kind of sort of practice, I would recommend that you promote your practice as Bija Shuddhi Chikitsa. So Bija Shuddhi has to be promoted. So Garbha Sanskar people need to understand that antenatal program does not begin after conception. It always begin before conception. So this is one clarity I would like to suggest, and that's how you can promote your businesses in further. And there's one, most of the doctors are practicing Bija Shuddhi Chikitsa, and I would recommend that you can promote your clinic as Bija Shuddhi clinic also. So it's a very happening thing these days. So Bija Shuddhi is something very important and it has to go hand in hand while we are treating antenatal program or while we are conducting antenatal program. So before going ahead with your diet and all, let's understand one thing, that whenever you are doing Garbha Sanskar or Bija Shuddhi, most important sutra from Sushruta Charistan is Drunam Dhruvam Chaturnan Sanidhyat Garbhaha Syat Vidhi Purvakam Rutu Kshetra Ambu Bijanam Samagrat Ankuro Yatha. This is a very, very, very known shloka by all of us, and this sutra is very, very important. So whenever you're planning for conception, for garbha dharana, garbha formation, there are these are the basic samagri matlab ingredients. So these are the basic ingredients necessary towards garbha formation, and that is rutu kshetra ambu bij. So even though we are going to talk about diet, even though we are going to talk about a lifestyle to be followed during bija shuddhi or antenatal program, but you should understand what is it, why is it important, and how is it going to be important, and what factors are going to be influenced after you follow the proper diet and lifestyle. So rutu kshetra ambu and beej, these are the most important factors which are going to be directly influenced by a corrected lifestyle and a corrected dietary regime. So hence this is very, very important to be understood by ourselves also as doctors, and to our patients also who are going to come and take certain treatments from us, or Garbhini for that matter. If we have a Garbhini coming to us for antenatal program for Garbha Sanskar, so she needs to understand. But preconception, of course, this is all uh, necessary ingredients, or the sutra basically indicates before conception. So we should understand this important factor. Sanskarohi gunantaro dhanam. Sanskar say gunan sanskar, in the sense garbha sanskar, this word basically is very commonly used. Antenatal programs or bija shuddhi we say, but antenatal programs is commonly termed as garbha sanskar. So most of the times it's said that garbha, like the fetus, and whatever sanskar we are doing, so basically directly the sanskar is happening on the garbha, at the garbha level. But we should always understand one thing, what happens with sanskar. So sanskar rohi gunantara dhanam. Of course, my topic today is not about other things, but I would vaguely explain you. So gunantara dhanam, whatever gun, in the sense whatever what do we say, qualities you are expecting in your child, so those qualities can be achieved in your child. Or even though, like most of the times, the parents, like the mother and the father, the genetic influence is there, and the genetics always pass on to the other generation, the further generation. So whatever genes the father is carrying, or whatever genes the mother is carrying, those genes are going to be passed on to the further generation. That is very much well known by all of us. The genes, the DNA, it goes to the further generation. And hence, if both the parents are absolutely fine, healthy, they're genetically absolutely fine, they don't have any genetical deformity in their family, then it's absolutely fine. All the good genes are going to be passed on to the garbha. But if there is certain genetical deformity or anything that is in a negative, there could be chromosomal defect or any kind of defects in either of the partner, either in the mother or father. So those genetical deformities or defects can be passed on to the further generation. Hence, this shloka, this sutra is very, very important. Sanskarohi gunantara dhanam. Whatever sanskaras we are doing with the antenatal program, whatever things we are conducting, right from the bija shuddhi, it could be anything, right from panchakarmas, lifestyle modification, dietary modifications. After that, we do antenatal programs, we do multiple treatments, we do multiple music therapies and instrumental therapies or raga therapies. Whatever things we are doing, this is going to help to have corrections in the gunas, in the whatever good gunas you want to be again in your child. So whatever qualities basically are expected by the parents, or they are going to be passed on to the further generation, has to be in a good form, has to be absolutely fine. Hence we have to make sure that we are doing certain sanskaras, so that the gunantara dhanam So whatever qualities are going to be passed on to the future generation, they are well polished. Polished in the sense they are well cleansed, for example. They're well polished and good qualities are passed on to the further generation. Like we do cooking, right? So if we get a vegetable from the market, it has got lots of pesticides and lots of other harmful insecticides or any other infestation on that particular vegetable. But when we actually cook the vegetable or steam the vegetable, those defects are gone. Any kind of insecticide or pesticide or any kind of infestation, if there is on the vegetable, it's gone. And eventually whatever we cook is in the purest form, devoid of any kind of infections. Similarly here also, whatever sanskaras are done on the bija in the sense both the parents initially, those sanskaras are basically gunantaradhanam, are polished, refurbished, and hence the sanskaras, whatever go in the future, are passed on to the further generation, are absolutely in the bestest and purest form, we could say, devoid of any abnormalities. So hence Garbha Sanskar is important not only after conception, but before conception. Also, most important thing I would like to say is Bija Shuddhi is expected to be done by both the parents, by both the partners, husband and wife. Both are equally responsible when it comes towards conception. We all know when the ovulation process happens, the sperm has to travel through the uterus, has to reach the egg. They have the sperm has to have to fertilize the egg, and once the fertilization happens, then only further the implantation is going to happen in the endometrium. But if the fertilization process is not successful, there is no further implantation, and eventually no conception will be, or no pregnancy will be achieved. Hence sperm and ovum have equal importance when it comes towards conception. I would say 50-50% role is there of sperm and ovum. Hence, we should always remember one thing, that Bija Shuddhi Chikitsa, specifically I'm saying when people come to us for preconception treatment. After conception, everything is done, the fetus is formed, so eventually that genetic makeup has already passed on to the fetus. So after conception, of course, there is a lot we can do, but before conception, we have a lot of scope to do when it comes towards Bija Shuddhi. Hence, when we are treating people or when we are treating patients, we should make sure that we are convincing both the partners to go through Bija Shuddhi and take the treatments, so that eventually the father and mother both are undergo with certain panchakarmas or whatever Bija Shuddhi Chikitsa we advised in the process, and eventually the sperm and ovum will be devoid of any abnormalities, not only at the structural level or at the anatomical level, but at the genetic level as well. And hence, further, when the fetus is formed, after then the implantation happens and the fetal growth happens, the growth and development happens absolutely properly. There are least complications during the pregnancy process, and when the child is born, the child is absolutely fine, healthy, and devoid of any genetical abnormalities. Hence Bija Shuddhi Chikitsa is very, very important, and not only for the female partner but for the male partner also, which is not very commonly practiced. Only Ayurveda recommends and suggests that both bija, because we are working on bija, right? So bija, it means seed. So seed in the sense sperm and ovum. So this is the bija we have to work on. Okay. So this you should understand before even going ahead with the Garbha Sanskar or antenatal programs, or even recommending people the antenatal programs. See, just now, as I mentioned, that what's the role of father and mother in Garbha Sanskar? Healthy ovum, Stri Bija, and healthy sperm, that's the Purush Bija, means Shuddha Bija Nirmiti. And eventually, healthy fetus, Garbha Nirmiti, will happen, and further abnormalities can be avoided. So Bija Shuddhi can be done in various forms. I will not be covering all these things because there are various further topics going to be conducted. But just now, as I mentioned, bija, the seed basically. So whatever shodhan sanskaras of sperm and ovum are done in the preconception stage. If you're talking about bija shuddhi, it means we are talking about the preconception phase. Okay, so it has to be done by panchakarma, meditations, yogasanas, certain medications, rasayan chikitsa, vajikaran chikitsa, weight loss, weight gain, if the female or the men or the male partner, if either of the partner is obese or has certain lifestyle imbalances, we have to change it. We have to make sure that we are correcting it. Then improving the ovulation, because see what happens now. I'm going to talk about Bija Shuddhi and I'm going to talk about diet and lifestyle modifications. But when we are talking about Bija Shuddhi, specifically about Bija Shuddhi, so Bija Shuddhi Chikitsa, everything comes under this. So Bija Shuddhi means we have to make sure whatever is going wrong, that has to be corrected. So indirectly, if you have a female or a male coming for treatment for infertility, you are doing certain panchakarmas and everything. So indirectly, we are doing Bija Sanskar or Bija Shuddhi Chikitsa on them, right? Improving the sperm motility. If there is certain abnormalities in the sperm parameter, we have to correct that. Similarly, if there are certain abnormalities in the female parameter, we have to correct that. Okay? Of course, I'll not take so much in detail because my topic today is, but I just want you to understand where we are going ahead for. So whatever panchakarmas we recommend as per the Prakriti, Dosha Dhatu, we recommend accordingly. Now talking about the Aharya Chikitsa. So whenever we are doing, of course, there is multiple things we have to follow, but make sure that the Ahar Chikitsa, the dietary corrections or the modifications is not only recommended to the female parameter, but the male parameter, the male partner, sorry, also needs to strictly follow it. Otherwise, what happens? The bija will not be formed in a good shape. The bija will not be devoid of abnormalities, and eventually the fetus form. That eventually there may not be conception, or in case if conception also happens, the chances of miscarriage is high, or further abnormalities in the child born may be seen. Hence, you have to convince both the partners to follow the diet, follow the lifestyle of what we are recommended. So, Aharya, in the Aharya Chikitsa, I will give you a proper diet chart also later on. But in general, Dugdha, cow milk is recommended, and cow ghee also. Loni means butter, but not that Amul butter. What butter we normally prepare before making the grita, right? Loni. Khadi shakkar, rock sugar, then grita, toop matlab grita, almonds, badam, kaya manuka means black raisins, anjeer, figs, kharik, dry khajur, dry dates, right? Dates. So dry dates is called as kharik. Khajur means dry, the dates. Khaskhas, then Panchamrut. Panchamrut is also very essential. So Panchamrut basically is a combination of, usually make it in the Prashadam when we have Puja, Satyanarayan Puja at our house, the milk and curd combination. So it has got milk, Panchamrut. It has got 5 kind of ingredients. It has got milk, it has got curd, it has got sugar, it has got honey and grita. Only grita and honey is not added in the Sama Praman. You have to have little more plus minus combination, but otherwise everything is almost in equal proportion. So that's Panchamrut. Then Palak. Then Palak in the sense that leafy vegetable. Then Dadim, pomegranate, Draksha, Avla. Draksha is considered as one of the best fruits, especially the black grapes. Best fruit according to Ayurveda. But of course, considering these days there's a lot of pesticides and insecticides used, so you have to make sure that you're washing it properly, thoroughly, and then only using it. Palak means spinach, okay. Then draksha, avla, amalaki, udit and til, sesame seeds. Eating at the right time, avoiding junk food. So when we are talking about the Aharya Chikitsa, these are the things what we normally recommend for them for on a daily basis consumption. So cow ghee and cow milk is one of the best combinations. So this is what I recommend usually for breakfast. I normally, whenever people come for Bija Shuddhi Chikitsa, and we do various panchakarmas and all. So most important correction when it comes in the aharya is asking them to have cow milk and cow ghee on a daily basis. So I normally tell them to skip the breakfast, don't have your breakfast. Instead of that, have cow ghee, cow milk, 1 cup or more also. And you have to add 2 tablespoons of cow ghee. In that, if you want, you can add Shatavari Kalpa also. But this is the best combination, and this has to be consumed on empty stomach for breakfast. So when you have this for breakfast, it's said that cow ghee and cow milk is such a combination that it actually passes to your stomach, and through the permissible membranes it actually passes to all your dhatu, rasa, rakta, mans, med, asti, majja, shukra. So basically it has got a very good vyapti. It basically reaches to all the dhatus, and hence it has got wonderful rasayan effect. Hence this is my drug of choice, and it is not only a ahariya dravya, it is also medicinal combination. Hence cow ghee and cow milk is my drug of choice for breakfast only, I tell them. And it takes time to get digested, because when you consume cow ghee and cow milk, you're not supposed to have anything after that except for water. No, nothing solid you should have, unless and until you feel hungry. Otherwise you're breaking the vyapti, breaking the permissibility of that particular dravya. It works as rasayan, and it's one of the wonderful combinations. And of course, I'll share a whole proper dietary regime again later on. And apart from that, Aushadhi Chikitsa, you must have read all these things. You can just recommend it. Okay. And most importantly, you don't have to make any major corrections. What happens is, like, people feel that what should we do when we have to change the dietary lifestyle, dietary corrections. So there is nothing as such major corrections you have to do, but you have to make sure that you're correcting what is going wrong. So whenever a patient comes to me for preconception, or even Garbhini for that matter, I normally see that what are they consuming as of now, what is their current diet chart. So I will first sit and write their dinacharya, right from waking up, then what will they have for breakfast, then later on, and what time. And not only what will they have, what time they are consuming is also very important. The whole day, what are they having? At night, what are they having? Evening snacks, what are they having? What time they're having the dinner? All these things are supposed to be seen, supposed to be corrected, and eventually worked upon. So basically, as I mentioned that when a Garbhini comes to me, I normally advise her to have all these things, whether it's a preconception or whether it's later. So Ahar Paricharya, in the Ahar Paricharya, most important thing to be followed is eating at the right times. As I mentioned that whenever we are having any kind of Garbhini or preconception, for the preconception also, like both the husband and wife, they come to us, or if the Garbhini comes to us for antenatal program, make sure that to understand her diet chart first. What is she consuming throughout the day? And not only what is she consuming, what time she's consuming, in what quantity she's consuming. So everything I have to write it down, and then accordingly I will correct the dietary regime. So what you have to correct, most importantly, we have to make them understand that eating at the right times is very important. Most of the people these days, they have dinner after 9 o'clock, after 10 o'clock, or maybe late also. So that is absolutely wrong. Before sunset only you're supposed to have your dinner, between 6:30 to 7. That's the time when you should have your last meal. But unfortunately these days everybody is working, and everybody is having a hectic schedule, and of course people are not aware. We being Ayurveda charyas, we are all Ayurvedic practitioners, we have studied Ayurveda. Hence we know that before sunset we should consume your dinner. But everybody is not aware of this situation. People don't know what's right and wrong, so we just have to correct them. So dinners before sunset is very, very important. Most important correction is have food only when hungry, and consume water only when she is thirsty. Otherwise, these days, people, there's a lot of misconception and myths going around that you have to consume 4 to 5 to 6 liters of water the whole day. So most of the people, as soon as they get up, they will have 2 to 3 to 4 liters of water in the morning itself. So that will load their kidneys, that will create imbalances. Hence, we should tell them that drink water whenever you're thirsty and eat food only when you're hungry. This is the most important correction you need to do. So when it comes to lifestyle, also they have to make sure that they have to eat on the at the right times. Dinners before sunset is very very important. One more lifestyle correction which is very important is they have to sleep early and they have to wake up early. Otherwise, these days, what happens? People are sleeping for good 6 to 7 to 8 to 9 hours also. People say that we complete our sleep, we sleep for good 8 to 9 hours, but they sleep late. They sleep at 1 o'clock, 2 o'clock, and then they wake up in the morning at 9 to 10 o'clock. So that kind of sleep pattern is not good for health. They should make sure that they're sleeping early and they're waking up early, and that's how they're going to have correct changes or corrections when it comes towards their health. So hence we have to mention that they have to sleep early. They have to make sure that they're sleeping at around 10:30, 11 maximum at night, and they're waking up by, ideally we should advise them to wake up at Brahma Muhurta at 4:30, 5 o'clock in the morning, but practically it's not possible for everyone. So I normally tell them at least try and wake up at 6:30 a.m. I personally also conduct yoga classes morning 5 to 6. I take up yoga batch because what happens, exercise is also very very much recommended, and most of the people are into gymming and rigorous forms of exercise. But Ayurveda does not recommend any kind of rigorous forms of exercise. Ayurveda suggests that asanas or any form of exercise has to be done half of your body's strength. If you get very much exhausted and very much tired after doing your exercises, it means you're overdoing it. So make sure you're not overdoing it also. So this is very, very important to understand how much asanas or how much exercise has to be done. Yogasanas is the best form of exercise. Yogasanas help to correct your or balance your chakras, balance the organ health, and every organ health is activated, and accordingly the functioning is also corrected. Apart from that, every single joint, every single muscle, every single ligament, every single bone of your body gets good stretching after doing yogasana. So yoga is the best form of exercise, and that's why I conduct a morning 5 to 6 a.m. batch for my patients only. And of course, there are many doctors also who join because lifestyle corrections begins from here, and people don't do it. We keep telling them that you practice yoga on a regular basis, but unfortunately people don't practice. They will not take initiative. So I thought I will take that initiative. I will start yoga classes, and I conduct those classes. And unfortunately, while enrolling 40-50 people have enrolled in for the classes, but actually only 7 to 10 people regularly come for those classes. It's an unfortunate scenario. People cannot push themselves, but it's okay. We have to make sure that we have to advise them, because we are here to advise them the right thing, and we cannot force them, right? But we have to make sure that we are giving them a right path. So this is a very very important lifestyle correction. They have to wake up early, sleep early. Dinners before sunset is very very important. Most importantly, boiled water should be consumed. Before conception, it's fine, but after conception, the Garbhini should strictly consume boiled water only, because after conception, overall strength, stamina, overall health of the Garbhini is deteriorated. Overall, Vata imbalance is seen, Vata vitiation is seen. Hence, the Garbhini should make sure that she is eating well, and infestations can be avoided. Cow milk twice daily with Shatavari Kalpa, daily till the baby is 3 years old, and most of the females can have Shatavari Kalpa, but Shatavari Kalpa contains sugar. So if the female or the male partner, if they are diabetic or if they are obese, then I normally give them plain churnas, then I'll not give them kalpas, okay? And I give it from the Bija Shuddhi only. It's not that Shatavari Kalpa is only good for breast secretion, breast milk enhancement. Shatavari is a wonderful herb. It's a rasayan. It works on all the dhatus, right from Rasa Dhatu to Shukra Dhatu, in both men and women. And it's the best rasayan, Stri rasayan as well as Purush rasayan. So Shatavari is my drug of choice. I give it to every infertility or preconception also. I give, and after conception also, right from the first month, you have to give them and advise them to continue Shatavari till the child is 3 years old. So the child will also get benefits of Shatavari, and not only the child will get, but the mother will also have the benefits, because Shatavari is good right from your head to toe. Shatavari is beneficial for um, everything. Like, it's good for your hair growth, it's good for your eye health, it's good for your skin health, it improves digestion, it reduces hyperacidity, it improves your constipation, and of course it improves your hormonal imbalance. So Shatavari is wonderful for both the partners. So before like Bija Shuddhi and also antenatal, both the stages you can advise. Most of the people complain that after having milk they have gases, and or they feel very bloated. So they can add shunthi, shunthi and vidanga while boiling the milk. So normally I tell that take 1 cup of milk, half cup of water while you're boiling the milk, then let it boil. And in that only you have to add half teaspoon of shunthi powder, and vidanga seeds you get. So around 4 to 5 vidanga seeds you have to crush and add it to the milk. Let it boil, let the water reduce, and only when milk remains, that milk they can consume. Okay. Now, most important, we have to also understand, as I just now mentioned, that I normally ask people that what time they are having what. People say that milk troubles them. Milk leads to acidity, milk leads to constipation, milk leads to gases. Most of the patients complain this. So we have to ask them what time they are having milk. So most of the people say that I have milk after my breakfast, or I have milk after my dinner. So basically, we have to make sure that we are explaining them or helping them to understand one important thing is that milk is basically very good for digestion. Milk is actually a laxative. So even though they are constipated, milk can actually help to correct the constipation also. Milk is actually very good for indigestion also, helps to reduce the acidity also, because it's shita, right? Virya, shita virya. But if people are consuming milk along with the food or immediately after food, that will trouble them, because dugdha or milk is a purna ahar according to Ayurveda. It's a complete meal, purna ahar. Ayurveda suggests that milk is purna ahar, means if a person is having a proper meal and after that if they're having milk, it means they had just had a meal, and immediately after a meal again they are having a meal. So it's like eating twice. If you're consuming milk after having food, it means you're consuming meal after having food. So doodh, milk is a purna ahar. It is as good as a meal. Hence it should never be consumed after dinner or after breakfast or along with food. Milk has to be consumed on its own. So ideal time for milk consumption is early morning, empty stomach. Like as I mentioned, for breakfast, I normally advise people to have milk and cow ghee. That's the best time. Or for dinner, they can, if they want for dinner, then they should skip the dinner. They should not have the usual dinner, whatever they are having, rice, roti, or whatever they are having for. They should skip that dinner and they should only have milk. Then only they will not have problem. Otherwise, people blame milk. Unfortunately, milk is a rasayan, and unfortunately, most of the people say that milk doesn't suit them, but it's only because it's wrongly consumed. Hence, you should first understand, and then we have to advise accordingly. Then butter loni, just as I mentioned, butter, not the Amul butter, the butter what we prepare after using the cream of the milk. Then buttermilk, chaj, we all know, but make sure it's not lassi, it's not thick. It is prepared using curd. Buttermilk is definitely hot in potency. So if a female is pitta prakriti, then you can just ask her to have it in moderation, but she can have it very liquid consistency. Like you just have to take 1 tablespoon of curd, add half glass of water, and then you can add pudina, jeera, whatever flavors you want to add, and then ask her to have it. That will not cause trouble. But if you have thick buttermilk, like lassi in the form of lassi, that is not good. Then ghee, grita is very, very good, but we recommend cow ghee, like go grita. Then dal, pulse, and vegetables. Dal, pulses are recommended, but in dal also, we normally don't recommend tuvar dal, rajma, chole, batana, chana. We don't recommend this on a daily basis because all these pulses are vatakar. They aggravate the vata. They lead to vata imbalance, and they may lead to bloatedness and further constipation and heaviness in your stomach. Hence, whenever it comes to pulses, these three pulses are recommended on a daily basis. Number one is moong dal, the green gram, moong. Then second is tuar dal, the red pulse, red gram, that is called as masoor. And the third important is hulga or kulatha, horse gram. So basically, moog, masoor, and kulit, in the sense horse gram. These three pulses can be consumed on a daily basis, and these will not lead to vata aggravation. These are hairs, these are light on your digestion. Only thing is the horse gram, kulatha, is basically hot in potency. Hence, after conception, it has to be consumed in moderation. But before preconception, it can be consumed. But of course, some people, Pitta Prakriti people, because it's Ushna Virya, Kulatha is Ushna Virya. So some people may have problems, some people may feel Pitta aggravation. So you have to make sure, see if it's suiting them, and then you can accordingly advise. But after conception, after delivery, sorry, Kulatha is very, very good. After delivery, postnatal, in the Sutika Avastha, Kulatha uh, yush, basically, in the soup form, is very, very good. It helps to balance the aggravated vata. It helps to reduce the stomach size. Like after delivery, the stomach, the abdominal size increases. So if they consume 1 bowl of Kulatha yush every single day for further 45 days after delivery, it will help to balance the hormones. It will help with Agni, because there's a lot of Agni Mandya in the Sutika Avastha. And of course, it will help to get back the stomach back in its shape. Okay, so Kulatha is very, very good, but it may aggravate Vata, Pitta, sorry. So you have to make sure, and accordingly you can advise it. See the Prakriti and then accordingly advise it. Lots of seasonal fruity leafy vegetables, but according to Ayurveda, leafy vegetables are not considered that shrestha because they are easily infested by worms, and there's a lot of pesticide used. Hence, uh, fruity vegetable is very much recommended by Ayurveda. In fruity vegetables, you can use dodka, rich gourd, then bottle gourd, dudhi bhopra, we call it in Marathi. You can use bottle gourd, rich gourd, snake gourd, or you can use gawar, what do I call? Then the chavli beans, French beans, all the beans and legumes you can ask them to consume. They can have red pumpkin, then karela is also good. So all the fruity vegetables is very, very good for consumption on a regular basis and shrestha according to Ayurveda. Seasonal fruits, fresh seasonal fruits are recommended, but Ayurveda, there's a list of fruits that has to be avoided in the Garbhini Avastha, which I will show you further. So, but in overall, I normally recommend you can have all seasonal fruits, but you should avoid sour fruits. The sour in the sense khatte, amla rasatmak fruits. So, amla rasatmak in the sense strawberry, kiwi, and pineapple has to be avoided. Otherwise, every seasonal fruit can be consumed. They are very good. Coconut water is good. Pre-conception and after conception also. Dinka laddu. Dinka in the sense gond. Basically gond, this word is very much popular. You must be aware of it. So gond laddu. So that this gond basically is fried in ghee, and other dry fruits like dry dates, then almonds, walnuts, little bit of cashew nuts. All these are roasted, or certain seeds also, sunflower seeds, flax seeds, pumpkin seeds. All this is fried or roasted in ghee, cow ghee, and these all are grinded, and then you can make laddus out of it. So this is very, very good in the preconception phase as well as during after conception also. Kesher, saffron is very, very good. So she can add this to the milk, or she, if she's preparing anything sweet, she can add it to it. Honey is good, but problem with these days is people consume honey with hot water, which we don't recommend according to Ayurveda. But the problem is that we don't get pure honey these days. So I don't recommend too much of honey on a daily basis because purity is a problem. But honey is very well recommended. If there's a very good source, you can definitely recommend. Khadi shakkar, rock sugar is very, very good as compared to normal sugar, white sugar. Then gehu, wheat, ragi, rice. Rice also, I don't recommend basmati. Basmati is highly polished, highly refined. Hence, basmati is not recommended on a daily basis. Jawar, cooked in iron kadhai. You should make sure that the utensils in which you are preparing your food, these are iron based. Hence, the natural loha bhasma or the iron will pass on to the food, and hence there will not be any kind of iron deficiency. Avoid soft drinks and hard drinks. This is very, very important. Very important is the Garbhini, behavior of the Garbhini. When in the Garbhini Avastha, what kind of lifestyle needs to be followed? She needs to take self-care, never hold natural urges like Mala Mutra. There are various natural urges, right? So we should never hold adharaniya vegas. So like your Mala Mutra, gases, she should never hold yawning, sneezing. Never sit or lie down on hard and irregular surfaces. We should advise them that don't sit or lie down on irregular surfaces. Always lie on the sides, never sleep on the back. Wear light colors, avoid loud sounds. This is very important. You will be learning a lot of things because what happens, all these factors not only affect the Garbhini, but they have a direct impact on the Garbha, the fetus. So loud sounds, any kind of loud sound, loud music may affect the fetus. Because of that, the fetus may startle, may get scared, and hence further complications may arise. Avoid rigorous exercises. Now, these days, we see that most of the people after conception are in the Garbhini Avastha. They do gymming, they do running, and what sort of exercises. But Ayurveda doesn't recommend any kind of rigorous forms. Yogasanas is recommended. Definitely, we should practice yogasanas. Avoid tikshna, ushna, junk food. Safe travel. Whenever, ideally, in the first trimester, you should avoid traveling. But if you still want to travel, make sure you're not traveling on a two-wheeler. Make sure you're traveling in a car, and long distance travel should be avoided. But first trimester travel should be avoided. Abhighat, direct abhighat over abdomen, any kind of external injury or abhighat over abdomen should be avoided. Do not wear tight clothes and high heels. Avoid alcohol and smoking. In the preconception, in the Bija Shuddhi Avastha, this is for the Garbhini and as well before conception also. But in the Bija Shuddhi Avastha, when people come to us for conception or for infertility, I strictly advise to stop any form of addiction if they have any. Like these days, most of the men and women are into smoking, drinking, alcohol, drug abuse, anything. So, first step is to tell them to stop smoking, drinking, or any kind of drug abuse completely, because study and research have suggested that any kind of addiction has direct impact at the DNA level, genetic level. So this can lead to miscarriages after conception. Firstly, so this can lead to infertility. So conception itself becomes difficult. But even though there is conception, miscarriages can happen. And after miscarriages also, even though if the child is born, the child may be born with certain DNA defects or chromosomal abnormalities. So hence, any couple who comes for conception or bija shuddhi to us, they should be strictly advised to totally stop alcohol and smoking if they are into addiction. Avoid sleeping in the afternoon and late night. Diva Swapna is definitely a no because it leads to Agni Mandya, and late night is also not recommended. Avoid stress, avoid intercourse. First 3 months, intercourse should be avoided for the Garbhini in the first trimester. Avoid watching horror movies or stressful television shows. As I just now mentioned, that it has a direct impact on the fetus. Hence, the fetus may become little scared or sensitive child may be born. Hence, you should avoid all these things. And plus, this has direct impact on the hormones also. Keep the household surroundings clean and tidy. Stay away from unpleasant, strong odors. Avoid stress, irritability, anger. Do not go near banyan tree, tamarind tree, and the word people tree. So basically, this is all mentioned in our granthas. Avoid looking at snakes. Avoid excessive sleep. More than 9 to 10 hours of sleep is definitely a no. But of course, in first trimester, most of the Garbhinis may have a problem, like they may have vomiting, dehydration, they may have loose motions. So in such cases, if she could not sleep in the night properly, then in such cases, I tell them that you get up in the morning, have little bit of milk and cow ghee, and then again you sleep. So Diva Swapna can be avoided. Don't ask her to sleep after her lunch, but she can sleep in the morning after having a little bit of ghee and milk, and then she can sleep. But apart from that, we should tell them avoid sleeping in the afternoon because first trimester is little tricky. There's a lot of imbalances happening and a lot of hormonal imbalances happening. And not only that, even mentally also, she may have a lot of mood swings. Like suddenly the Garbhini feels happy, suddenly she feels sad, suddenly she feels energetic, suddenly she feels low on energy. So these imbalances is very common in the first trimester. Even food related to mood swings related to food also. So hence we should understand her and make sure that she is being comforted and she is being counseled well, that it's fine, this is absolutely normal, and she should have a good supportive system in her own family. That's very important. Avoid bad thoughts, bad behavior, robbery, etc. Very important because we should always understand whatever behavior, whatever thought process the woman, the Garbhini goes through is directly connected to the fetus. I always say this that the mental and physical well-being of the Garbhini is directly proportionate to the mental and physical well-being of the fetus or the child in the womb. Hence, the Garbhini should make sure she is fine, she is happy, she is not having bad thoughts, she is not having any other bad behavior for that matter. But of course, just by saying that don't think negative or avoid bad thoughts, it doesn't help because you have to help them not to have bad thoughts. So there are multiple things that we advise, like meditation techniques, neuro-linguistic programming, chakra dhyan, and multiple Garbhini positive affirmations. Then there's Garbha Samvad. So multiple things we advise during the process of Garbha Sanskar. So hence this is very, very important so that she basically indirectly we have to make sure that you are helping her with brain programming during the Garbha Sanskar process. And hence, she will not eventually have bad thoughts and she will have a good pregnancy phase, basically. Okay. Now, fruity vegetables, as I just now said, Dudhi Bhopra, that's bottle gourd, Gusari, Tondli is the small gourd, then potato, Padavar. Padavar is, I think, snake gourd, then Kohla, Kushmanda, then Karela, Bindi, that's ladyfinger, then carrot, red pumpkin, palak, spinach is very, very good. Basically, it's rich in folic acid. So any kind of folic iron deformities or what do we call deficiencies can be avoided, because folic acid is very much recommended in pregnancy. So naturally, how much we can give, we should focus on that. It helps to avoid garbhasrav, missed abortions also. Then apart from that, kothimbir means coriander, ale in the sense adrak, just ginger, then coconut, lemon, pudina, chilies, jeera, carom seeds, cumin seeds also helps to aid digestion. So, but of course, don't have it in that form. I normally tell them to prepare a chutney with all these things. They can add coconut, nimbu, little bit of pudina, green chili, jeera, little bit of groundnut, and then they can and coriander, and then they can prepare a chutney and they can consume it on a regular basis. So, in that form, you can definitely give. And tupaji fodni, in the sense, the tadka what we give, you can give the tadka with cow ghee. Cow ghee is very, very good. It has a very high smoking index. Hence, you can fry things in cow ghee. You can cook, you can bake. So, cow ghee is very, very good. It has a very high smoking index. Hence, the essentials of cow ghee, essential nutrients or micronutrients are not lost. Hence, cow ghee is very well recommended. Apart from that, essential nutrients in food, iron-rich foods, loha yukta, palak, spinach, methi, mart, sakwat. These are leafy vegetables. Sakwat is a little bit sour vegetable, what we give. Chavali greens, then mooli. Mooli, I am sure mooli, you know, that white thing, that white root basically, radish. Mooli is radish. Aru basically is, if you know this, what do we call? We use this root only and leaves also of aru. Arbi, aru in the sense arbi, and sarso, mustard leaves. You have to make sure that you're having leafy vegetables. While you're having leafy vegetables are rich in iron, rich in loha. So you have to make sure you're adding lemon juice. Lemon has vitamin C, and vitamin C enhances the absorption of iron. Hence, you should always consume iron with vitamin C. So lemon has to be strictly consumed along with your food. Also add black raisins, then dates, beetroot, pomegranate, apple, amalaki, kesher, jaggery in your food. Now in grains and pulses, gehu, as I mentioned, wheat, ragi, that's nachni, moong, green pulse, green gram, masoor is the red lentil, rice, jowar is very, very well recommended. Rice also, as I mentioned, basmati you should avoid. Other local forms, now you all, most of the people are based in South, so there's this boiled rice or something, I'm not very much aware. So whatever local rice is produced in your area, in your locality, has to be consumed. Avoid basmati rice, highly polished rice. Have whatever is grown locally. The vegetables also grown locally in your locality. Urit, just so as I mentioned, horse gram. Then other pulses, matki, tuvar dal, there's arhar dal. All these can be consumed little bit in moderation and occasionally. Apart from this, chana, chole, rajma, chavli, pauta, vatana, all these pulses, soya bean has to be avoided. Raw uncooked food and pulses. Most of the gynecologists after conception, they are behind protein supplement. They tell that have protein. So most of the Garbhinis or even preconception also, most of the females consume protein supplements. So certain protein powder is given. But apart from that, they are also recommended to have sprouts and all these pulses, chana, chole, rajma on a daily basis. Also, they are advised have a lot of paneer and tofu also. But all these pulses we don't recommend on a daily basis because they are vatakar. But they can have moong, masoor, and purit, as I mentioned. And apart from that, protein powders is all processed. So I personally don't recommend any artificial supplement. I tell them naturally you have your proteins supplements. Non-veg, if people are consuming non-veg like chicken, mutton, fish, So I normally advise them to avoid red meat, but chicken and fish is fine. But that too, they can consume it maximum once or twice a week. Don't have it on a daily basis because it's heavy on stomach, is hot in potency, and plus is heavy for digestion and high on calories also. So avoid it on a daily basis. Apart from that, for protein supplements, they can have moong masoor and put it on a daily basis. Egg white is also good. But whatever food they are consuming on a daily basis, make sure they are consuming in moderation. At one time, they should not overeat. I normally tell them, I'll just show you if I find that image. I normally tell my patients that whatever my Garbhini or preconception or after conception also, whoever comes to me, I normally tell them that you should have in moderation because our stomach is just fistful. Okay, papaya, I normally, pre-conception, bija shuddhi is absolutely fine. But after conception in the Garbhini Avastha, papaya needs to be consumed in moderation. Because we all know it's hot in potency and which can lead to contractions of the uterus also, which can lead to miscarriages, but little moderation is fine. All these vegetables can be consumed, as I mentioned just now. Then most of the females have a lot of dehydration because in Garbhini Avastha, when the female gets up, wakes up in the morning, she has morning sickness, she doesn't feel like having, or she may have loose motions, she may have vomiting. So most of the gynecologists, they give them ORS or they tell them that as soon as you wake up in the morning, have one or two Mari biscuits. But Mari biscuits and all, they have got maida. So we don't advise maida, right? Because maida is highly processed and it is like a slow poisoning ingredient. So maida is not recommended for a daily basis. But we normally what I recommend is they can have this laja manda, what we give normally, sari lahi. That is very good to have it on empty stomach. Apart from that, if they are having dehydration, they can have avla sarbat or they can have kokum sarbat or nimbu pani, lemon sarbat, lemon water also is fine. Okay. So as I mentioned, sour food we don't advise. Tamarind, for example, it also comes in sour food. But kokum is very good. So kokum, if you see on the right side, there's this small black colored. So tamarind, like tamarind only, but kokum has cooling properties and it aids digestion also. Tamarind has little, it's hot in potency. It can aggravate the pitta, which can lead to acidity, hyperacidity. But kokum will help to calm down your pitta. Hence, kokum, like that only you can have it, or you can have it in the form of sharbat also. Drink also, you can make the drink and have it. All seasonal fruits, as I just saw mentioned, but in our granthas, it said that vegetables to be avoided is do not have raw uncooked vegetables. Have koshimbir also post blanching. If you're preparing koshimbir, like salads and all. Because normally in salads also we use raw, right? Whatever salads we make, we use raw food. So in salads also you should make sure that you're having cooked or blanched items. So if you're having salads, you can just blanch. For example, you're having carrot salad or cucumber, you can just boil water, add your cucumber or carrots into that, and then switch off the gas flame. Keep it for 5 minutes in boiling water, and then you can just strain it and have it. But don't have raw, uncooked vegetables. Have koshimbir, means salads, post blanching. Sweet potato ideally is not recommended. Yam is not recommended. Suran, corn, mushroom, capsicum, gawar is a legume. Eggplant, spring onion, tomatoes is not recommended by Ayurveda. But as I mentioned, little bit in moderation, you can definitely advise them. It's fine if they have it in moderation. Then fruits to be avoided is cut and eat fresh. Mango. Now this is the season for mango. So most of the people crave for mango. So mango is hot in potency. And if they have to consume mango, they can have maximum one mango daily. Don't have more than that, especially in the Garbhini Avastha. And I normally tell them that mango has to be soaked in water. Before consuming mango, take water in a container and put that mango in that water, keep it for good 1-2 hours, and then you have that mango, so that the mango becomes lighter for digestion, and also the aggravated, basically Ushna Viryata is reduced after soaking it in water. Kairi, in the sense raw mango. Chinsa is tamarind. Bor is bear, badar. Then kavat, if you know. Then ananas means pineapple, pear. Peru is guava, strawberry. Sitafar is custard apple. Then ramfar, chikku, jamun, jambul, and Kalingad means watermelon. All these fruits are advised by Ayurveda. This is all mentioned in our text to be avoided in pregnancy. But the thing is that practically it's not possible. So I tell them to have it in moderation. Okay. Most important is maida. Most of the people, see, just now, as I mentioned before that, people have a habit of consuming biscuits, bread, khari, toast, most of the bakery products on a daily basis because it has got a lot of maida. It is definitely not good. Maida is highly processed and it is like a slow poison. If you're consuming maida on a daily basis, it can lead to indigestion, constipation, and various problems. It can lead to arthritis and other ailments also. Hence, maida is not recommended on a daily basis. But people are not aware of it. Hence, we have to tell them that this is not good. This is prepared with maida. So this is something I ask them to avoid. And milkshake, milk and fruit is a viruddhana, is an incompatible food combination. We all know this. Hence, we don't advise it. Most of the people have a habit of having milkshakes. So they add fruits and vegetables and milk and everything together, and they have it in the form of smoothie. But that's a completely wrong combination, incompatible food combination, which can lead to problems in future, and not only to the Garbhini, but can have adverse reaction on the fetus also. If the Garbhini is consuming maida on a daily basis, junk food on a daily basis, if she's having a habit of having a lot of packaged food, or she's having a lot of soft drinks or milkshakes, this can have direct impact on the child. The child may develop certain allergies, have low immunity, or have skin problems in future. Hence, she has to be advised accordingly. Okay, and sugar, maida, breads, biscuit, bakery products, milkshakes, burgers, soft drinks, hard drinks, tobacco, smoking, BD, mishri, it's all tobacco only. Then vada pav, fried food items, pani puri, bhel, fermented stuff. Most of the people have a habit of having a lot of idli and all. So basically, idli is fermented. Of course, in South India, it's like a staple food. Most of the people in South consume idli, dosa, and all on a daily basis. But they prepare fresh batter every single day. If you are not preparing fresh batter, if you're fermenting it more, then it's going to trouble you. And of course, the weather also. In Maharashtra, there's a lot of heat, and fermented food items don't suit here to people. So I don't recommend here. But in South, I know people consume it on a daily basis, just staple diet. But the only problem is the tuar dal, the tur dal, arhar dal. Because in sambar, you mostly, or rasam also, you mostly use tur dal, arhar dal. That is the correction you need to advise them. You need to tell them that don't have arhar dal because it is very hot in potency and it's also heavy on stomach. Hence, those things should be avoided. And of course, fermented stuff, biscuits, basmati rice, refined oil. But most important is they can have it in moderation once in 10 days, but have it for lunch, don't have it for dinner. So basically, they can have it in moderation. Now, this is an ideal diet chart for Bija Shuddhi and Garbha Sanskar also. Uh, so, most important, just now I wanted to mention our stomach, everybody's stomach, whether it's an obese person, whether it's a thin person, whether she's a Garbhini, everyone has fistful stomach size. This much. Our stomach size is just a fistful. So we should understand that's what is called as mindful eating. If you're consuming food, you should understand that whatever fits in this much fits. Like if you have two rotis or three chapatis, then you add rice, plus you have vegetables and all. Lots of people have a habit of having salads, and after food also they will have something sweet. So imagine you're overstuffing, overfeeding yourselves. Overfeeding is also not recommended because this can lead to indigestion. This can lead to lowered micronutrient absorption, hence leading to certain deficiencies in further. Hence, this is a very important thing we should make people understand. Now, this is a diet chart, which is very good, ideal diet chart. But as I mentioned, I have mentioned the timings here. But most important thing is that they should eat only when they are hungry, and they should drink water only when thirsty. Early morning, they can get up, they can have a glass or half a glass of warm water with lemon juice, or avla juice is also good after 15 to 20 minutes, or along with this only, because we are having lemon or avla which has got vitamin C. Hence, along with this only, I ideally recommend to have black raisins, walnuts, almonds, dates, and panchamrut, as I mentioned before. So lemon, vitamin C, enhances the absorption of iron, which is present in raisins and dates and walnuts also. After that, they can have breakfast after 30 minutes or 40 minutes. But if their Agni Mande is there, if she does not feel hungry, then don't forcefully eat. Have homemade, freshly prepared upma, poha, or this is not something everything you have to have together, or two boiled eggs, or shira, that sweet semolina we do semolina, and we add sugar and milk and all. Then moog dhirde, this is moog chilas you can have, like dosa only, but prepared using moog dal or whole moog also. Then chapati sabji, thali peet, milk and 2 spoons of Shatavari Kalpa. And as I mentioned, that milk and ghee is my staple. I normally tell them to have cow milk and cow ghee as breakfast. Then mid-morning snack. Again, if she is hungry, then only she is supposed to eat. Most of the females think that they are pregnant and they have to eat a lot of food, and they have, because there's already they are feeding themselves, and plus they have to feed the child. It's not like that. They should mindfully eat only when hungry. In fact, if they overeat, that can lead to problems. A fruit or coconut water or salad, or they can have fresh juice or dink laddu, as I mentioned, gond laddus. Then lunch again, one chapati, reduce the proportion. Then dal, sabzi, rice, dal, and koshambir. Post lunch, she can have half fresh buttermilk, because buttermilk is kashaya rasatmak. So madhur amla lavana katu tikta kashaya. So kashaya ras has to be consumed in the end of the meal. So she can have buttermilk. Then evening she can have a fruit, boiled egg, coconut water, gond laddu. But again, if she is hungry, then only. 5 p.m. she can have milk with shatavari. If she is not hungry for milk, then she can just have Shatavari Kalpa with water also. And before 7, 6:30 to 7, the dinner should be finished. For dinner, she can have one chapati, dal sabzi, rice dal, or she can have ragi, jawar roti. And specifically, if obese female comes to me, if before conception also and after conception also, I normally tell them to consume moog chila for dinner. Like either it's moog dal or it's whole moog. I tell them to grind it, soak it, and then grind it, and then they can make dosas like chilas out of it, because moog is rich in protein. And if a person is obese, then for dinners I don't recommend carbohydrates like rice, roti, or even ragi, jawar. These are also carbs only. So I don't advise carbohydrates for dinner. I advise them to have one or two mook chila for dinner. Mook chila is very light on your stomach, is rich in protein. So eventually they will not have, like if it's Bija Shuddhi preconception, then they will lose weight. And during Garbhini Avastha, if she is obese, then she will not put on a lot of weight in her pregnancy phase. Excessive weight gain is also not good, right? Hence, we recommend this. And before also, as I mentioned, if a Garbhini is having high sugar levels, then Shatavari Kalpa can be skipped, and you can give plain Shatavari Churna also. Then walk slowly for 5 to 10 minutes. After meals, sitting Vajrasan or lie on the left side, Vama Kukshi, and sleep by 9:30 to 10 p.m. or maximum 10:30 p.m. So this is an ideal diet chart what we give have junk food only once a month, and that too for lunch. As I mentioned, usually I tell them have it after every 10 days, but if I tell a Garbhini that have it once a month, at least she will maximum have it twice a month. But if I tell her that have it after every twice 10 days, she will have it 3 to 4 times in a month. Hence I tell them have it once a month, so she will have it twice a month. Then have daily different vegetables and fruits. Try and have palak spinach soup daily. As I mentioned, it's very rich in folic acid, and plus it helps to avoid garbhastra. Eat small portions of meal at a time. Do not over it, because our stomach is fistful. So hence have only small portions at a time. If you overeat, that will lead to indigestion. She may have acid reflux. All the food will come out. Then she may have vomiting, nausea, all these things. If she is having little small portion of meal, that particular meal will get properly digested, and the micronutrients from the food will get well absorbed, and hence she will not have any certain deficiencies also. Eat after every 2 3 hours, but only when hungry. If there is a lot of dehydration because of nausea, vomiting, keep having kokum sarbat or lemon juice or avla juice also, sip by sip the whole day. Most of the gynecologists they recommend ORS and all, but there's no need. You can just have this. Do not starve also. Most of the Garbhinis they are obese, and if they're obese, they feel that she will put on a lot of weight in her pregnancy phase. Hence, we should tell her that don't starve also. Starvation is also not good. Do not think about excessive gymming or any form of rigorous exercises. Do not sleep in the afternoon, but if she's tired, exhausted, she may just lie down. But as I mentioned, that if she did not sleep well the whole night, because it may happen, especially the first trimester is very challenging, so she may not feel sleepy, or she may have pain, aches, she may have discomfort in her back, she may have nausea, dehydration, vomiting, loose motions, whatever the reason is. If she does not sleep well at night, in the morning I tell them have little bit of cow milk and cow ghee and go to sleep, so she can complete her sleep in that time. Do not sleep continuously on your back. Sideways, she should lie down. Okay. So this is about the dietary guidance for the Bija Shuddhi and lifestyle guidance. So in the lifestyle, as I mentioned before also, that make sure she's consuming right time, right things. As I mentioned before also, that people should understand waking up early, sleeping little early, and completing that good 7 to 8 hours of sleep, but the timing should be correct. Secondly, they should have dinners before sunset between 6:30 to 7. Some form of exercise on a daily basis, but yoga sanas preferably is the best form of exercise. And most importantly, as I mentioned, that she should not sit on hard surfaces, she should not listen to loud music and all those, that chart what I shared. Everything has to be followed properly, and then only you can see great results. So always understand Bija Shuddhi is what is recommended by Ayurveda and is the first step towards Garbha Sanskar. But of course, most of the times we have people who come to us after conception only. So it's absolutely fine. But if you have people who come for Bija Shuddhi specifically, you can recommend this program. Okay. So I'm done with my session. But if you have any queries, feel free to ask.
Thank you, ma'am. Thank you so much for this beautiful session. It was very informative, along with all the dietary precautions, and during pregnancy was very informative and practical also, ma'am. Thank you so much. So now the session is for audience. Dear doctors, you can either unmute yourself, you can post your queries in the chat box. The queries are welcome. Thank you. Dear doctors, I request again to kindly unmute yourself. You can post your queries in the chat box. You can post your feedbacks also. And it's a very wonderful session. I really wanted all the participants to post your feedbacks also regarding the session.
Yeah, if you have any queries, just post it in the chat box.
Ma'am, there is a question.
Yeah.
Ma'am, best time to consume Shatavari Kalpam.
Yeah. See, Shatavari Kalpa, as I mentioned before also, na, can be consumed. 1 second. Na? So Shatavari Kalpa can be consumed basically with milk, as I mentioned. So early morning empty stomach, because it's a rasayan, na? So early morning empty stomach is the best time. So for breakfast, I normally give it with milk, cow ghee and Shatavari. You can add, and evenings also, 5 to 6 p.m. when your stomach is little empty, that time also you can have Shatavari Kalpa. Okay, any more queries you have?
Dear participants, you can post your feedbacks also regarding this class. Ma'am, there is one query from Dr. Banu. For morning sickness, what can be given?
Okay, see, morning sickness, what happens now? In allopathy, in gynecologists, mostly they say that if you have morning nausea, they and mostly dry vomits or they may have vomiting. So most of the gynecologists they ask them to consume dry 1 or 2 Mari biscuits, but we don't recommend that. So if you have morning sickness, ideally we should tell them avoid having anything, because morning sickness in the sense there is some sort of Agni Mandya. So Langan is the best chikitsa, but still they can have Laja Manda, the Laja that we use, a Lahi. So Lahi is good. Laja Monday, you can just ask them to have it dry only. So instead of Mari biscuit, let them have a half bowl or like half katori of that Laja, like that only dry. Even Laja Manda can be consumed in dehydration. So if they're dehydrated, Laja Manda can be consumed in dehydration also.
There are good feedbacks also. Like it was a great session, and thank you, ma'am. It was a very nice session. So, any queries from the participant side, you can unmute yourself or you can post your queries in the chat box. Ma'am, then we'll wind the session, ma'am. As there is no queries, we'll wind the session.
Sure.
Thank you
Thank
so
you
much.
all. Thank you so much for having me.
Thank you all for joining the session. And thank you, ma'am, for sharing a very valuable information with us. Thank you, participants, for your enthusiastic support and participation. See you all in the next session. Thank you, ma'am. And on behalf of Ayurveda
Thank you
Map,
all.
thank you all.
Thank you so much.